execution, I would argue, is our fundamental problem in healthcare. And there's a variety of studies. I thought this was the most compelling to indicate how widespread these problems are, from Health Affairs in 2012, that found that among Americans and Europeans who died before the age of 75, at least 30% would not have died if they'd received appropriate medical treatment for their condition, including in places where virtually everybody has full access to care. The work that Kate Baker had shown out of the Oregon experiment, in many ways, natural experiment, indicating that coverage provided financial security, but not really strong evidence of healthcare benefits in many directions, is an indicator of this fundamental problem that although we have come through a period of improving coverage, it isn't necessarily clear that we've improved delivery. I got my start doing this work, connecting public health and healthcare delivery as a resident when we did this study while I was at the School of Public Health in Kate's department. And we did a study looking at 28 hospitals across Utah and Colorado. We looked at 15,000 patient records of people discharged from the hospitals. My job was to look at the surgical records. The surgical records told a story almost identical to the non-surgical records. 2/3 of the patients underwent a surgical procedure. 3% of the patients had something go wrong where they died or had a major disabling outcome. Among those, at least half, 54%, were preventable with existing knowledge that simply had been failed to execute correctly. Furthermore, as we've dived into the details, this is what you find in the medical records. It goes even higher when you dig in even further and do interviews with people. And this really just ended up echoing work that Lucian Leap, who's here, had demonstrated almost a decade before, and in showing that the role of research has to be not just the discovery of new breakthrough innovations and treatments. It has to be about follow-through science and innovation as well.